Please give him a warm welcome. Je vous présente John Brohan with Anonymous Medicine.
Okay, let's go. Anonymous medicine is some medical test or service offered with no attempt to find out your name. There are different areas where it works and some where it's totally inappropriate. We'll start right off with an anonymous medical test. If you can see a number, you're red-green colorblind. Anybody can take this test, and nobody cares if you do or not. A hearing test using a telephone is another thing. You dial a number, they speak some numbers quietly to you, you answer. And this is a good screening test for bad hearing. AIDS is a more important disease. You can lose your job or your family just for taking the test. And the anonymous test increases the testing rate. They give you a number, put a number on the vial of blood, and you phone in later and they tell you the result. I work on a project to measure urine flow using a cell phone to listen to the splashing sounds. Do we try to get the name of the person, or do we just use the phone number? This is the chart that we produce. It's your report. You're looking at it. It's your test. It's expensive and difficult to get people to register a name. Now we get to the technology. How do we do this? When you forget your password, they send you another one. They don't give you the old one back. And the reason for that is they don't know it. They've done something like this. They've taken a number, multiplied it by pi, producing a large number here. Then they take out some numbers to throw it away, and you get a hash number that cannot find its way back to the original. It goes one way and not the other. A program that uses this technology is used for locating Alzheimer patients. You don't need to know who he is. You just need to know where. Here we're talking about questionnaires for embarrassing subjects like suicide or prostate health. Whoa, we're getting go. We'll skip this one. The important thing about anonymous record keeping is that if you use this hashing thing for the identity, then nobody at all can know whose record it is except the person who's got the key, who's got the phone number or the key. Where are we? Okay. So a company with a medical test is likely to, first of all, to think of the obvious way to do it. Give out the test, get paid for it. But sometimes these medical tests require a great deal of effort and money to capture the name and the billing. So with this anonymous medicine, you have risk. With all medicine, you have risk. And we need to group together perhaps many of these small sites offering a hearing test or other tests where the risk can be managed professionally. Now, these are new risks in a fragmented market. Okay, and here is one of the ways that risk is risks of lawsuit. The software didn't work. The old guy with Alzheimer's got lost, and he was carrying your software. So the risks are too big for small companies to take, and it requires a large company with skilled expertise and layered knowledge and money. Small companies are very frightened of lawsuits. So people are expecting things from their cell phones, and maybe this anonymous medicine is another thing that people are coming to expect. Okay, and so I think it's mostly what I'd like to give you tonight is the possibility to think about storing medical records without knowing whose they are. Thank you.
Thank you, John. Merci.